So patients want to know, how long does a genicular artery embolization procedure last as far as pain is concerned? The GAE, or genicular artery procedure, is intended for knee pain control. And it's a valid question to ask whether this procedure is going to work, number one, and number two, if it works, how long can you expect the pain relief to kind of last? Now, let's kind of break down how the procedure is performed and how it's intended to control pain, and that's going to answer this question for most patients. So what we try to do is, with this procedure, the pain is related to inflammation. It's very rarely the case that the entire joint has inflammation. What happens is that you get pockets of inflammation that's causing the pain. This is why patients will say, doc, the right side, it's on the outside. They can almost pinpoint with a finger where the most intense pain is. And this is exactly how the procedure is done. We put a little marker there, and under our x-ray, like a metallic marker, and under our x-ray, we target exactly where that pain is coming from, because that's usually where we see the blush of increased blood flow, and that's where the inflammation is. So when we target that, we close down those little tiny blood vessels, go into that inflammation, the pain there goes away. It's a permanent situation. These are blood vessels that can no longer carry blood, and the inflammation there goes away kind of indefinitely. Now, when it comes to recurrent pain, it is very common that a patient could have, or it's very possible that a patient could have pain in another part of the knee joint that requires the same kind of procedure. But this, inflammation, this is not something that happens all of a sudden. These things are happening over a span of years because of the joint and the bone on bone kind of rubbing up against each other, causing inflammation. So if you don't have pain in other parts of the knee, it's not like it's going to come on anytime soon. So the need to have a repeat procedure is usually not months, it's usually years. And it's usually located in a different part of the knee, if that. So hopefully that answers the question as far as, controlling knee pain where you're having it. The GAE procedure is a permanent type of procedure. The chance of you having recurrent pain in the same area is pretty slim to none. It is possible that you may have inflammation in a different part of the knee requiring the procedure, but if you're not having pain there now, it's not one of these things that's going to happen all of a sudden. It usually takes years of the bones rubbing up against each other to where you're going to get inflammation that's causing pain. So hopefully that was an answer that you can understand, and it was informative in understanding how the GAE procedure works and what kind of pain relief you can expect from it. In any event, if you have any further questions, feel free to call us or make an appointment at one of our facilities. We'll be happy to sit down and talk to you in more detail and kind of explain what's involved with the GAE procedure and what you can expect. And we would be happy to even go over all the research. So feel free to give us a call. Take care.